everyone! If you're getting ready for your phlebotomy certification, you already know that mastering the neonatal Heelstick isn't just a nice-to-have skill, it's an absolute core competency. Honestly, getting this right is so critical, not just for the safety of our tiniest patients, but for your success on the exam. So let's dive right in. So here's our game plan. We're going to walk through this whole procedure step by step. We'll start with the why, why we do it in the first place. Then we'll get into the nitty-gritty of preparation, the collection itself, and those super important finishing touches. And we'll wrap it all up with a quick-fire review of the key things you absolutely have to know for your exam. All right, first things first, why the heel? Really understanding the reason behind this procedure is the first step toward performing it with the kind of confidence and precision that makes a true professional. So let's start with this question, because it really gets to the heart of it all. For these little ones, infants under a year old, why do we go for a heel stick instead of a regular venipuncture? Just take a second and think about the anatomy of a baby. And here's your answer. The heel stick is a procedure that was designed specifically for this. It's built to get us into that rich network of capillaries on the bottom of the foot, while keeping a safe distance from all the delicate stuff like the calcaneus bone, nerves, and tendons. So when you do it right, it's hands down the safest and most effective way to get a good sample. Okay, next up, preparation. I'm telling you, the success of your draw is decided long before you see that first drop of blood. A meticulous setup and careful verification, that's what's going to prevent the most common and the most serious errors. This sequence right here, it's completely non-negotiable. You start with what we call closed-loop identification. That means matching at least 2 identifiers on the wristband, the requisition, and any labels you have. If there is any mismatch, you stop, period. After that, you'll confirm everything's good to go, wash your hands, get your PPE on, get the baby positioned, and then inspect every single piece of your equipment. Okay, listen up, because this is a huge exam topic. This is one of the things they test on most frequently. You have to memorize this order of draw. It starts with blood gases, then your EDTA tubes for hematology, then any other additives, and serum tubes are always last. Following this exact sequence is the only way to prevent cross-contamination from the additives, which could totally mess up your samples. Now we're getting to the foundation of what makes a high-quality specimen. Seriously, the work you do right before the puncture, picking the right site, prepping the skin, that's what makes the difference between a clean, easy sample and a painful redraw for the baby. This slide tells you everything. It shows you exactly where to go and, probably more importantly, where not to go. The only spots that are okay to use are the medial and lateral parts of the plantar surface, basically the fleshy outer edges of the sole of the foot. You have to stay away from the central arch and that back curve of the heel. Puncturing those danger zones means you risk hitting the calcaneus bone, which can lead to a really serious infection called osteomyelitis. Now, before we puncture, we often need to warm the heel up a bit to get that blood flowing. But there is a very strict limit here. The heel warmer can never, ever be hotter than 42 degrees Celsius, which is about 107 Fahrenheit. Any hotter than that, and you're going to risk burning the infant's super delicate skin. And here is another number that you need to burn into your memory for the exam. The lancet depth for a neonatal heel stick has to be 2.0 millimeters or less. That is the absolute maximum depth. It's all about preventing that bone injury we just talked about. The cleaning step seems pretty straightforward, but that air dry part is so critical. If you don't let the alcohol evaporate all the way, a few bad things happen. First, it's going to sting the baby. Second, it can hemolyze or break down the red blood cells in your specimen. And third, it'll contaminate the sample, giving you inaccurate results. So let it dry, don't blot it, don't blow on it, just let it air dry completely. All right, we've done all our prep work. Now it's time for the collection itself. This is where your precision, your technique, and that strict order of draw all come together. The flow here is pretty simple, but you have to be precise. You make a single, firm puncture in the safe zone. Then, and this is key, you wipe away the very first drop of blood. Why? Because that first drop is full of tissue fluid and maybe some leftover alcohol, and it will ruin your sample. Only after you wipe it away do you start collecting the nice, free-flowing drops that come next, in the correct order, using just a little gentle pressure above the site.
Pay really close attention here, especially when you're dealing with your hematology tubes. The CLSI guidelines are crystal clear. You have to fill that EDTA tube exactly to the fill line. This makes sure you have the right ratio of blood to additive. And then you have to immediately and gently invert it 8 to 10 times. This is what prevents tiny little microclots that would make a complete blood count impossible to run. This is another exam favorite for sure.
I really can't say this enough. If the blood flow starts to slow down, your first instinct might be to squeeze the site to get more. You have to fight that urge. Aggressively squeezing or milking the heel just contaminates the sample with tissue fluid and destroys the red blood cells. A good sample comes from a free-flowing drop. A bad sample means you have to do a redraw, and that's just more unnecessary pain for the baby. Okay, let's talk about the final steps. Your job isn't over just because the tubes are full. Proper aftercare and following safety protocols are every bit as important as the collection itself. This is a massive safety rule. You never, ever, ever put an adhesive bandage on an infant's heel. Their skin is way too sensitive, and you can damage it when you take the bandage off. On top of that, a small bandage can actually become a choking hazard if it comes loose, so the correct way is to just apply gentle pressure with a sterile gauze square until the bleeding stops. All of your labeling has to happen right there at the infant's bedside before you even think about walking away. No exceptions. Every label needs 2 patient identifiers, the exact date and time, your initials, and, this is really important, the explicit source. Writing capillary, heel, tells the lab exactly how that sample was collected, which is essential for them to interpret the results correctly. So, we've covered the whole procedure. Now, let's just lock in the most critical, high-yield facts that you're going to need to know for your certification exam. Think of this as your final cram session. This table pretty much summarizes your entire workflow. You've got site selection in those safe zones, a puncture depth of 2.0 millimeters or less, that super strict collection order, and then your post-collection care with gauze and bedside labeling. This is the core process. You need to know it so well that it becomes second nature. Okay, exam tip number 1. If you only remember one number from this whole explainer, please make it this one. The maximum heel puncture depth is 2.0 millimeters. This is the absolute key to preventing bone injury. And exam tip number 2. If you only remember one sequence, this is it. Capillary blood gases are always first, so they don't get altered by exposure to air. They're followed immediately by the EDTA tube to prevent clotting. Getting this wrong can literally invalidate all the other tests you run. So, as you get ready to take all this knowledge and put it into practice, I want to leave you with a question to think about. Whether it's double-checking that patient ID, confirming your lancet depth, or reciting the order of draw in your head, which one of these critical steps are you going to make your personal, non-negotiable safety check that you do every single time? Because developing that professional habit, that's what truly defines an excellent phlebotomist.